Hello, everyone, and welcome to another exciting episode of our Elite Award Dry Eye Patient Educational Series. And I'm very excited. Today's guest, Dr. Thu Nguyen, and she's an optometrist at Eye Connection Optometry in San Diego, California. Welcome, Dr. Nguyen.
Thank you. Hi, everyone, and thank you for tuning in.
We're very excited to hear a little bit about you, about your practice and case studies that you're going to be presenting.
Sure. So I graduated from New England College of Optometry more than 10 years ago. It's hard to believe. And I did residency at the San Diego VA in primary care with low vision rehabilitation.
Okay.
Shortly after that, I came back to the Bay Area to practice where I'm from, in a large ophthalmology practice up in Monterey Bay.
Okay.
And then worked a little bit more in San Francisco before moving down here where I started Eye Connection Optometry in mid-2019. So
wow.
My office is very small. I have one staff usually, and I practice full scope optometry. So I do routine eye exam, medical office visit, red eye, and a particular passion of mine besides dry eye treatment and management is actually myopia control treatment. So not many people know, but there's actually treatment available to slow myopia down, especially it's actually indicated for children. And so I want to spread more awareness about myopia management too.
Okay. So interesting that you started in 2019 pre-COVID, and now post-COVID. Are you seeing an increase in dry eye, various age groups?
Oh, definitely. Especially when pandemic hit, we are working more from home, more screen time. So not only do I see a lot of dry eyes in adults, but also in children. And I suspect perhaps it's due to a lot of screen use. So screen use really reduced the blink rate, and the blink is what caused the oil to come out to help keep the tears on the eyes.
Yeah. It seems like it's much more prevalent now, post-COVID than it was even before.
Sure.
Okay, well, we have two patient case studies that you're going to be presenting. Tell us about this first patient.
Okay, so this patient has been with me for the last 3 years. So she's a 54-year-old female accountant. So spends a lot of time on the computer looking at small numbers. And so she was complaining of more like discomfort with her contact lens wear at first. Eye strain, fatigue, itching, burning. So on examination, I typically screen everybody for signs of meibomian gland dysfunction in dry eyes. And she also answered the speed questionnaire, which her response, I think, was more of the high teens, so quite symptomatic. Her dry eye score, the Schirmer test, was not too reduced, so it's not aqueous deficiency, meaning she can produce tear. But on the surface of your eyes, when it was stained, there's no presence of SPK, meaning epithelial defects on the surface. But we do see presence of these irregularity. So she has a condition called basement membrane dystrophy. So the basement membrane becomes redundant, so it's not really attached to the bottom layers very well. So it's a bit rough and jagged. And so every time she blinks, her lids rubs over it, and it can feel like a foreign body sensation. And so you can see those photos right there. She does have signs of that irregularity. You can have the map on the top. The left eye is more prominent, that instead of a smooth, nice, even green, you can see those map-like appearance on the surface, those negative staining on the surface on there. But other than that, she doesn't have defects. There's no defects where it highlights and stain up. She did have presence of buildup on her eyelashes. That's not relating to Demodex, which is a mite, but more of like an oily film deposit on there. And then it's her glands are difficult to express using a Q-tip. So I can imagine that when she's blinking, not as much oil is being distributed to her tears to retain the tears on the surface.
Mm-hmm.
So all those conditions makes her symptomatic for sure. And when she wears contact lenses, it's not as comfortable, especially when she was wearing the replacement schedule lenses.
Right.
So for her, we started out having her do the Zest treatment, which is an eyelid deep cleaning and exfoliation to clean the biofilm, the deposit, and contribute to inflammation and dry eye. The other one was we did a meibomian gland expression in the office, and that right before the expressions, she warmed up her lids with the warm compressed mask. I believe she had the eye cloud to warm up. So I do about 12 minutes treatment, and that helps soften that oil, melt the oil, so it's easier to express with the forceps under anesthetic. And so we're able to express oil out, to clear those blocked oil to promote new oil production and flow. For at-home treatment, I recommended for her to do lid scrub, lid hygiene to maintain a cleaner lid environment to reduce buildup of inflammation there. So that one, she used the Teacherol eyelid 1%, the anti-aging one. She also does the warm compresses, although she admits with me that she's not as diligent with them, but she tries her best. As we know, we're all super busy, gets tired at the end of the day, but as often as possible. For her case, I also recommended the Hydro Eye, which is an omega-3 supplement to reduce inflammation internally. So I like to kind of make a comparison. We are reducing inflammation externally by removing debris, biofilm with lid hygiene daily, warm compress to keep the oil flowing and moving, and also internally reduce inflammation with omega-3 supplements because nutrients is really important in dry eye management. For her, because of that foreign body sensation, I also recommended preservative-free artificial tear as needed. With contact lenses, we do want to use preservative-free and a non-oil base. At bedtime, what I recommended for her was to use refreshed cellulose, which is a bit more viscous. So then her eyes are more moist when she wakes up in the morning. Typically, the eyes are most dry when you wake up in the morning. And in her case, we really want to manage her dry eye because it can worsen the corneal dystrophy that she has that can cause a corneal erosion. So upon waking up, when the eyes are so dry, the lid lifts up and the tissue is not well attached. It can lift off and cause really severe pain called a corneal erosion. So for her, dry eye management is really critical to prevent secondary complication. And that's the recurrent corneal erosion in her case.
Wow, wow. Yeah, I am noticing that you had the in-office treatments. When meibomian gland expression, was that a manual gland expression?
Yes,
Correct?
it was.
Yes.
It was using a forceps to squeeze out. I like to kind of describe as expressing like a pimple, for example. There's going to be some pressure. There's not going to be pain, but you're going to need that pressure to milk out that oil, that obstructed oil. They really need to get that pressure out. And so they understand, so they kind of anticipate, some pressure going on. So it's pretty well tolerated.
Oh, okay. That's
Yeah.
great. Yeah. So tell us a little bit about the changes in signs and symptoms and why you love this story.
So as I mentioned, her tear film improved a little bit. It's not the best, but an improvement is what we're going towards. She doesn't have eye fatigue anymore. That was one of the problems she had working on the computer all day. And I think that was because not taking enough breaks, and taking breaks on the computer is really important in terms of comfort and also in the dry eyes management as well. So the grittiness she still feels and the sandy sensations because of the secondary condition, the recurrent corneal erosion, that irregularity, instead of the corneal surface being nice and smooth, it has that waviness appearance to it because these layers underneath are redundant and it's not well attached. And so we do expect that the condition can worsen, But as long as we manage the dry eyes, we can really reduce that risk from progressing and causing the cornea to erode and vision to be decreased.
Mm-hmm. Yeah, very, very interesting. I know that I've heard a lot of practices use the speed score, and
Yeah.
it seems like it varies, but where would you say is kind of the cutoff between like, okay, it's not really bad enough to where like it's extremely bad? Like, is it like an 8? Is it a 9?
Um, I use the speed questionnaire, but not every cases I feel like signs, the symptoms equals signs.
Right.
There are cases where I see that their eyes look so red, the tears break up so quickly, and they're so dry. But on the speed questionnaire, it's like 0.
Mm-hmm.
So I take it with a grain of salt. I do it, and then I repeat it when they start treatment after a few months. But that's not the only thing. I will look at both symptoms and sign. Even when they have symptoms and there's no signs on the eye, I will look further and see what else is going on that's causing them to feel these symptoms.
Mm-hmm.
So we have to just take a look at the whole picture. Who the patient is, what they do, what kind of environment, what medication. Those are all conditions that influence, that impacts dry eyes symptoms.
Mm-hmm. Yeah, very, very, very interesting case study. So on your second one, I see that you have somebody a little bit younger, age 31.
Yes.
Tell us about this patient.
So this patient's definitely, the case was more complex. So she's a new mother. I think she came to me for a second opinion on dry eye because all she was recommended was over-the-counter drops. There's not much more they could do for her. And she seems pretty desperate because she came in with wearing sunglasses. She couldn't tolerate the sun because it was so bothersome. It made it so that she was difficult to open her eyes, sandy and gritty, and it's just in the left eye. And so vision was reduced. And she's picking out these mucus strand from her eyes because it would just accumulate.
Wow.
So when I checked her vision, the right eye was 20/20, no correction at all. She doesn't wear any glasses or contact lenses. Left eye was 20/200. So when we had this big discrepancy, we're like, what's going on? And it couldn't be improved much further with prescription evaluation. So you can see the dry questionnaire is 26 of 28, which is really, really symptomatic. So on the slit lamp evaluation, I typically start with patients closing their eyes. This is because we get the view of the base of the lashes to detect for presence of blepharitis, which is quite common, but is underdiagnosed because it's usually not looked at if we're moving fast through the exam on there, but it's so critical in dry eye management. So for her, she had these base collarettes, which is very telling that she has Demodex, which are mites infestation within the eyelash follicle that is contributing to the inflammation that she has. So you can go over, I think, one more. You can see the lashes on the
lashes,
yeah. So you can see those two first one before the debridement and treatment. That is, so you can actually see that without a microscope.
Yeah, yeah. In fact, I noticed it right away. Yeah.
Yes. So the history with her was that she had eyelash extension for a special occasion. And since then, she just felt more irritated. Her eyes were irritated already, but when she had the eyelash extension, it became even more irritated. So she got them removed. And then, so of course, we did the deep cleaning of the lids, and those two pictures after were after the treatment. So it's nice and clean. Right there.
Oh, yes,
on the other side. So that's after the treatment. It's a little bit lower. Yeah. So those are so she was able to maintain good lid hygiene with 2% tea tree oil lid cleanser from iEco. And then I also had her use Avenova to clean the lids as well, and the bottom lid, which is more difficult to get to. So she had a combination of both there. So let's go back to the first one where we take a look at these images of her eye. So on presentation, the right eye, the cornea is nice and clear. There's no staining at all. But the left eye, we zoom in a little bit more, you can actually, that whole surface is matted. It is stained. And so think of like your skin having a deep scrape over it. So of course, her eyelid blinking over it, she has that irritation, foreign body sensation, sandy, and light sensitivity, because when light goes through, it's more scattered. So she was very uncomfortable. And so both eyes had Demodex blepharitis, the filamentary keratitis because of the mucin strand that developed, and that's usually from chronic severe inflammation. She does have aqueous deficiency dry eye because when we did the Schirmer test, her score was probably under, I think at that time was under 3 millimeter in 5 minutes. She does have signs of mild meibomian gland dysfunction as well. The oils are more cloudy and some of them are blocked on expression. So with her, that day we placed on a bandaged lens to allow her to be more functional. So what a bandaged lens is a clear lens, and it helps protect the upper lid from rubbing over the surface and causing more irritation. So that photo there on the second set, that is after 2 days. So it's much better compared to the other side. And her vision was also improving as well.
Yeah, I'm looking at it from the standpoint of these look like they're linear.
Those are just, I would say that's coalesced. Like it's so minor one will be more like tiny specks on the surface.
Little dots, right?
Yes, but when the dots expand, it gets bigger, it will join together and it becomes so coalesced. So if I were to grade this is more of the highest level of epithelial defects on the surface, superficial epithelial defect.
Yeah, and this was just after 2 days then.
It's after 2 days, yeah. So you can imagine with the lens in, she was able to open her eyes and to be able to function. So to be a new mother, taking care of an infant and her business, and to work under this kind of discomfort, you can imagine that she was really suffering. And then the last photo on there.
Oops, I'm sorry.
Yeah, on this slide, that is after 1 week of bandaged lens.
Wow, incredible.
So almost cleared up.
Almost clear, yeah.
Almost. In her case, it's not, this particular case, if we remove the bandaged lens, the dryness, the exposure is still going to be there. So we end up having to put punctal plugs in the lower puncta in both eyes, and that helps increase more tear volume in her eyes. And we trialed the temporary plugs first to make sure that she noticed some improvement there before putting in something that lasts longer. So we did that in her case and put in more semi-permanent that lasts for 6 months. So when she came back for follow-up, if the bandaged lens is not there, the keratitis returns. So we're getting so much exposure. We needed something that keeps the tears on the surface longer. And so we end up having to do a scleral lens fit for her. And before the scleral lenses, I wanted to see if Cirrus autologous serum will work for her as well, because autologous serum essentially is blood drawn from the patient and centrifuged. So we use the serum part, mix it with balanced salt saline solution to make her natural tears. This is because it has nutrients similar to the natural tears to help with the healing property. So with the vital tear, she's using that as well as artificial tear during the daytime. It was not enough to heal the surface. And so I proposed that because she was nursing, there are medications such as Restasis or Xiidra that reduces inflammation. and help with tear production that we're not able to prescribe.
Mm-hmm.
So I propose that we use something called Scleral Lens. So Scleral Lens essentially is a large diameter lens that's fitted, so then it forms a reservoir of fluid. So that fluid is in contact with the eyes all day long, so it stays moist without that exposure.
Yeah.
So in really severe cases, I fit scleral lenses for that. So in this particular case, I had the patient mix preservative-free saline, no preservative-free tears, like refresh or sustain, but make sure that's preservative, in combination with her vital tears together in that reservoir that's in contact with her eyes throughout the day. And that is the only thing that will help keep the surface moist during the daytime without having that exposure. And she finds much more relief with this one here because we can't do banished lens forever on there. And so this one I find is a good solution until she's no longer nursing, that we can start prescribing anti-inflammatory medication for her.
Right. Yeah, that makes sense. I think
Yeah.
that that's obviously something that I've heard even as I mentioned earlier, we have a person that is on maternity leave, and
Yeah.
apparently this is a very common dry eye is a very common occurrence
Yeah.
with new mothers. Yeah.
Yes. Yeah. Hormonal change and all that. But
Mm-hmm.
environment plays a role as well. So just talking to the patient and understanding, okay, you know, is there any fan in the house, AC, heating, anything like that when you're in the car? Make sure the vent is not directly at you, that is down or up. So we don't want that moving air across the surface of the eye that desiccate the surface. So that's environmental change. So for her, I also recommended doing the Hydro Eyes, which is the dry eye omega-3 supplement. I had her primary care order the Sjogren test because I suspect with such severe dry eyes at a young age like her, relating to not enough tear production, it can have a systemic association. So Sjogren is one of the conditions that I had her get worked up for. So we're still waiting on the test results for those. I recommended her having a humidifier to increase, and that's better for dry eyes in more humid environment. Warm compresses for her, and also more viscous drops if that's not enough during the evening time. So overall, she's doing a lot better than where she started, but we're not done because where we are, we don't want, typically with one scleral lens on one eye, more difficult than having in both eyes. In this case, it's so asymmetric that when we have one lens in the eye, that difference there makes it not the most optimal condition as well. So once she is done nursing, then we can explore other options to manage her dry eye for the long term.
Yeah, I would imagine that every patient is completely different, and so you
Yes.
have to be able to assess obviously the requirements for various in-office treatments and at-home therapies, and it's really exciting to hear how you help these patients. Would you say that compliance or the ease of use of at-home therapies is good, not so good? Are patients compliant, or are they less than ideal when
I think
using these?
compliance depends also on symptoms. Those who are symptomatic, I find that they're more compliant. But also those who understand the progressive and chronic nature of the disease is more compliant. And that's why on initial diagnosis, I like to kind of go over what dry eye is, and in severe cases, what it can cause, and why we want to start treatment now when your symptom is less or no symptoms, even because I do see signs. So they're more compliant when they understand what it is, what it can progress to, and how that it can impact their vision and comfort. In those cases, I find that they're more compliant. But those who don't understand it, tend not to do that.
Right, right.
Yeah, and I mean, we're not perfect. I have dry eyes myself, and it's asymmetric. And of course, I do the treatment as often as I find time to do so. But just I said that the first thing you want to do is establish routine, because when we're a creature of habits. And so when we incorporate into our routine, it's much easier to do that. We don't have to think about it, right? Just like brushing our teeth when we wake up in the morning. So I kind of point out the same thing with lid hygiene, warm compresses. As our oral hygiene, we floss and we brush. Our eyes, you want to scrub the lids, clean the lids, and do the warm compresses. And so it can be something that's part of habit.
Well, thank you again, Dr. Nguyen, for impressive case studies. For those of you who are joining us and are in the San Diego area, Dr. Nguyen is at Eye Connection Optometry in San Diego, California. And Dr. Nguyen is a recipient of our Elite Dry Eye Award. And so we encourage those that are in the area that if they're looking for a great dry eye doctor, that you found one. So I thought I heard your cat in the background. Does your cat have dry eyes?
Not that I know of.
Not that you know. Well, thank you so much again for joining us, and make sure that you stay tuned for other upcoming live events. And we wish everyone a wonderful weekend. Thank you so much.
All right, thank you.
Bye-bye.